Hello. Good morning. How are you? It's pleased to meet you. So, you referred to me by your doctor for migraines? Okay. And he thinks my therapy may work? Okay. How long have you had these bouts? And about how many hours or days do they last? Okay. Do you have an aura right now? Focusing on my fingers. Are they very clear? Okay. You see haze? No. Okay. So there's no aura right now. All right. Well, I just want to look at your eyes, and it is a bright light. Just real quick. I just want to take a peek. Okay. Yeah. Let me check your other eye. Hold still. Oh, yeah. I can see you're very stressed out. Sorry to shine that bright light in your eyes, but what we want to do is get to the bottom of this problem. Now, what side of your head hurts? Okay. And yes, when did this start? When did this migraine attack exactly start? All right. Very good. You may be a good candidate for this treatment. It's really simple. So I want to quiet my heart and my breathing, and I want you to do it with me. Breathe in through your nose. Breathe out through your mouth slowly. There you go. Very slowly. In, out. Yes. I'm just going to check your heart and your pulse. Very good. Okay. All right. I can hear your heart. Let me just check your pulse. I can hear your heart calming down quite a bit. Do you feel all right? Okay. The therapy is very simple. And I will explain it while I get my equipment ready. This is more therapy than medical. What you're dealing with. Do you understand how a heart attack works? Okay. Basically, your heart is still beating, but the different lobes of the heart are beating out of rhythm. Because of this rhythm of your four chambers of your heart, the two sides, they're not synced up. Okay? So because of that, we need to take out the paddles. We put a little bit of stuff on the paddles, seen the movie, and we shock the heart. We shock the heart back into rhythm. I believe migraines attack the brain on one side, not the other, because the brain is hemispherical. The hemispheres of the brain are so advanced that the evolution of the human mind is not caught up with the physical changes. The synapses and the electro signals back and forth through the neurons become confused, out of sync. As much as we have to shock the heart into rhythm, I believe we're going to need to shock the hemispheres of your mind, one side or the other, of your cerebral cortex, back in the rhythm. Just as you can trigger a heart attack with too much stress or dietary issues, too much salt, lack of salt, I believe the same thing can happen in your mind. Your brain can become out of sequence. It was shocked into an irregular signal. The neurons are firing wrong. That's why you have pain in one hemisphere. We have to get both sides of your mind in sync. Just like a machine, in sync together. And when we do, your mind will be at peace in one, not two. Now this is groundbreaking. I just want to wipe you off a little bit. There we go. Very good. Does that feel good? Good. And I'm going to squirt a little bit of glue to attach the electrodes to your head. Okay? So hold still. I'm just going to squirt it onto this cloth. And I'm going to apply the sensor probes to your head. You feel that? There you go. Don't worry. Okay. They'll stick now. And we'll perform the procedure on the other side of your head. A little bit of glue. That's nice. And the same thing. This time, attaching it to your head. There we go. Sorry, are you alright? Alright, there you go. Okay, that should stick. Now, I'm going to do an inspection on your head. So, I just want to touch some of the skin. And now this side. Okay, very good. Alright. How's that feel? Very good. Okay. Alright, then we're going to get you in a more relaxed state, and we're going to proceed from there. Alright? Yeah, that's good. Right about there. Very good. Okay. Alright. Now, we're just about ready. I need you to close your eyes, try to relax best you can, and I'll be right back with you. Okay? Very good. Okay, close your eyes and try to relax for a few minutes while everything sets up, the glue and the probes, and we get our electrons attached. I'll be right back in just a minute. Okay. Bye-bye. Okay, winky wink. Okay, you couldn't get any sleep? Oh, I understand. It's not easy. Let's just check a couple things before we get started. Just checking. I'll make sure everything I've done is not causing any harm to the dermal layer of your skin. Last thing we want to do is get a negative reaction. Now, we're going to do a little bit of reflexes testing. Okay, do you feel that? Okay, it'll be no harder than that. And we're going to check to see if you have some proper reflexes for the test to be administered. Okay? Just getting my tools ready. All right. This won't harm you a bit. Ready? Okay. How'd that feel? Okay. Okay. Keep focused on me. Good? Okay. Very good. Okay. Once more. All right. Very good. What we do now is we use these little electrical stimulators. Okay? And I place them around your ear. Okay? One at a time. And as the pain eases in one side of the hemisphere to the other, it's very important that you tell me what kind of reaction you're getting. And I'll do a little bit across your forehead too. Okay. All right. If you feel the tension easing, what's going on is the minor electrical pulses at the tips of these fiber optic cables are helping your muscles and your brain relax. The electrical signals are going through your mind, helping sync the signals. Okay, so let's try that. First, on the this side, on the left. And now we'll do the other side. Now, putting my hands on either side, we're going to do them both at the same time. Now try to hold as still as possible while I do this. I'm going to keep my eye on my equipment. Alright, just one ear at a time. I can definitely see the signals. Okay, now this ear. Okay. You do feel it. Very good. I got to move a couple things. I think we're getting some real progress here, don't you? I'm feeling really good about it. I can see some definite changes in the biofeedback on both sides. Okay, once again, let's get those on either side. See, doing one ear at a time. I can definitely see the equipment. Feedback. Do you hear that? Okay, that helps. It really does. It helps me because what I'm doing is, as I'm going to get my assistant in here later and we'll get some massage techniques on the neck and across the head. And what happens is, as you're doing that, you start to see on my device here, you start to see the biorhythms. Instead of them being like this, out of sequence, they start to come into sequence. They start to match up, mesh. And that's what we need right now. Very good. So let's try that again. You like that? Okay. let's check your reflexes again. Now this side. Definitely getting there. How does that feel? Good, 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 good. Okay. This light, does this cause any problems for your eyes? Okay. Is it bothering your eyes at all? Not as much. Okay. Now this can possibly be a little painful. So much brighter light. I'm going to bring it slowly into your left eye. Let's cover up your right. Is that too bright? Very good. Very good. Now let's cover up the other eye. Okay. Do you see what I'm getting at? The sensitivity is a lot less. Does that hurt? Very good. Does that hurt? No? Okay. I definitely think we're making some serious progress here. Okay. Real quick, I want to check your heartbeat. And I know I'm going a little quick. Just a minute. You're calm and your heart rate is very slow. So I want to do another one, another series. So what we want to do is this time we want to come across your forehead like this. Do each hemisphere again. First this side. And now we're going to do the other side. This whole procedure is taking a little more than 20 minutes. Now, I took my gloves off because I wanted to have more deft with my fingers. What I'd like to do now is I'd like you to close your eyes for just a moment. That's it. Side right now. I don't want you to suffer, so I want to make sure we have good biofeedback before I let you do it today. Okay. Now I'd like to work on this side just a little bit. Very good. please open your eyes again? Okay. As relaxed as you can. Please allow me to do just a little bit of head massage to you. Very good. How does that feel? All right. Very good. Very good. Very good. Okay, can you lean down? Okay. This is much more relaxed method. Now, you can sit back up now. Okay, now what I'm seeing on my machine is a lot of the signals are passing back and forth now. Do you feel better? Okay, let me try one more stimulus. Reflexes are perfect. I can definitely see a difference. Do you feel a difference? Good. Okay. Now, what we're going to do is, this might be a little uncomfortable. I'm going to use a different type of fiber optic brush. It's harmless, doesn't hurt my hand. And one side at a time. The biofeedback is incredible. What we're actually doing is treating the opposite side of the pain. Can you tell the difference? Yes. Try to relax. Very good. Okay. Now we're going to move to the other side. Hold still. Just do the best you can. The biofeedback is matching up. I really feel comfortable about this. Very good. Very good. Okay. Okay. How do you feel? Better? Good. Okay. I feel good about it too. Okay, I think we can probably use this solvent now to get those. Put my tools away here. Get these probes off your head gingerly as possible. What we don't want to do is cause you any more physical distress on your head by removing the probes. Okay, and let's get that solvent. And we're going to wipe that off on the probes. And some solvent for the other side. There we go. And get that wiped off over here. Get those probes off your head. Okay. Now how's that feel? A lot better, isn't it? Very good. I feel really positive about this experience. Now, here's the problem with migraines. What triggers one person may not trigger you. So it's very important that I get some feedback on this, and I know, okay, this worked for you. It helped loosen the stress in your mind, and it helped relieve the pressure and the pain. If it didn't, it's very important that you tell me what did and didn't work. It is. It's important. Because if it didn't work for you, we don't want to repeat that. I know you found some relief today from the therapy, but we want to make this program specifically tailored to your mind. Okay? So, don't be afraid to tell me. Okay? All right. All right. Very good. Well, it was a pleasure working with you today. And I'm sorry I didn't tell you my name earlier. I was in such a hurry to get you out of your pain. My name is Dr. Andrew Michaels. And I'm here to help you. Yes. Pleased to meet you too. I hope you have a most blessed day. Okay. She'll show you out. There you go. Bye-bye. Very good. Bye-bye. I hope you liked the first test of my 3DO binaural microphone. Just in case you didn't know from reading the description below, this is only the second time I've ever turned this microphone on. I wanted you to experience this first video right along beside me. I think sharing, building videos together through suggestions, as this was a suggestion, helps me build a better channel and a more pleasurable experience for all of you. I hope you have a wonderful weekend, and until I talk to you all again, have a most blessed day.